Hi, this is Dr. Jeff Cole, one of the fellowship-trained hand surgeons at OrthoSouth. Whether you or your family's problem is pediatric, sports, arthritis, fracture or other trauma, nerve or tendon issues, or overuse, hand surgeons are equipped to treat all hand and upper extremity ailments, ranging from the most simple conditions to catastrophic injuries. We use a team approach with our hand therapists to ensure rapid and optimal recovery. Surgery for the thumb CMC or basal joint is indicated when conservative efforts have failed. Rather than specific X-ray findings beyond the diagnosis of arthritis or rigid rules or measures, the patient generally knows when they are ready for surgery. There are several accepted surgical techniques for thumb CMC joint arthritis. All procedures involve partial or complete excision of the rectangular bone at the base of the thumb called the trapezium. This solves for the mechanical bone-on-bone pain between the metacarpal and the trapezium. Some surgeons harvest a tendon graft to be implanted in this space, while others prefer placement of a stemmed implant, similar to what is used for shoulder and hip surgeries. After exploring all of these techniques during my practice, I prefer the mini TightRope procedure for several reasons. These include long-term durability shown over a greater than 12-year track record, a low revision rate that approaches zero over that same time frame, no issues with implant instability or implant failure as seen with stemmed implants, no harvesting of a tendon graft, ability to start therapy at 3 weeks, and excellent function with suitability for both males and females, and in particular patients with higher physical demands. The surgery is done as an outpatient procedure in a surgery center setting. We typically use general anesthesia with a supplemental nerve block. Surgical time ranges from 45 to 60 minutes. The procedure is done through 2 separate small incisions. A 1 1/4 inch incision over the top of the thumb gives access for removal of the trapezium. A second small incision allows the implant to be connected to the index finger metacarpal and properly tensioned and tied. The patient is placed in a well-padded half cast or splint the day of surgery. They return to the office at 7 to 10 days for suture removal, X-rays, and placement in a thumb spica cast. This is left in place for 2 weeks. At 3 weeks total, the patient returns for conversion to a hand-based splint and initiation of hand therapy. At 6 weeks, we allow the patient to begin light to medium level activities out of their splint. We check with them a week later and give final instructions with regard to heavy activities such as golf, tennis, or swinging a hammer. In closing, I would like to introduce you to a patient who recently completed surgery on the second side. I'll let him close out this video in his own words. So this is Mr. Earps. He's 6 years, status post CMC arthroplasty on the left, and just 2 months status post on the right. How have things gone for you?
It has been great. Looking forward to the right being as well as the left turned out. Never had a problem with the left hand, the left thumb since that surgery, so I'm looking forward to the right doing the same.
How about strength on the left?
I have probably 95-96% strength that I had before and opening. So I feel good about that, and I feel good about this one.
Which is just 2 months out, right? Or 7 weeks?
Right.
Any limitations on the left?
No, it has not affected anything that I do around the house or at work, nothing after 6 years, and that's why I was so eager to get the right one done, because this one, the left, worked so well.
Awesome.